If your hips feel stiff, painful, and jammed when skating, it's usually not a strength problem. What's missing is hip rotation. Most hockey players are limited in two movements that we need the most, being internal rotation and hip flexion. And these two are connected. To move into hip flexion, especially when skating, the hip must be in internal rotation. But for many hockey players, the hip already starts in a compromised position, being more inside the socket. So when trying to fix the hip, not enough space in the femur to glide back. And when the hip rotation is blocked, the stress has to go somewhere else, getting discomfort in the groin, the hip flexor, the lower back, or the knees. The goal of this exercise is twofold. Restore the backside space of the hip socket and train the muscles to control internal rotation of the hip properly. Starting on all fours with your knees underneath your hips and your hands underneath your shoulders. If you're working on your left hip, you're going to cross that right knee behind you, making contact with the shin on your left leg. What you should feel is a stretch on the back of the left glute. If you feel it in the front of the hip or groin area, what you can do is push your arms further in front of you. If you want to feel a deeper stretch, what you can do is place your body weight on your forearms. Intensity level should be a 4 or 5 out of 10 through the stretch. This is opening up more space on the back of your pelvis. Hold this position for about 30 seconds to a minute. Now that we've created space, what you need to do is now access your internal rotators, and this is how you do it. Lie on your left side down with your feet making contact with the wall. Make sure that both feet are making contact with the wall, having your heel, your big toe, and your pinky toe never losing contact. Pull the top knee slightly forwards for about 3 centimeters as you lift up the bottom leg off the ground. What you're going to feel is the inside of that left thigh activate. As you roll the top knee forwards, you're going to inhale through your nose for about 2 to 3 seconds. And as you push the bottom leg against the foam roller, you want to exhale through your mouth for about 5 seconds. You're going to do this for about 3 to 4 rounds. This should help significantly with your skating ability and to get down into that deeper squat.